Hi, my name is Pam Wall. I'm a psychiatric nurse practitioner, and I'm one of the program faculty for the Psych NP program here at Duke School of Nursing.
Hey, I'm Sean Convoy. I am also a psychiatric nurse practitioner assigned here at Duke School of Nursing.
What we really thought carefully about when we built this curriculum was to address the needs, not just on a larger community, the needs of the nation, but the needs of North Carolina. So North Carolina, if you think about it, is a largely rural community. So we thought, number one, we really need to embed some telehealth competencies throughout the entire curriculum. So really that is some of the foundational things that you're going to see in this curriculum. Every clinical semester that these students that are in the program, they're going to be introduced to telepsychiatry components. They're going to learn how to deliver mental health, not just in a traditional brick and mortar setting where they're like in a room with you and me, but also in a virtual environment. That's every single semester, building to the culmination of having a telepsychiatry certification, where not only they have the certification, but they're also afforded the opportunity to have that business model where they can set up their own telepsychiatry practice as they graduate from this particular curriculum.
I think one of the things that will kind of distinguish this program from other programs, if you look at all the psychiatric nurse practitioner programs that exist across the country, they all have similar components. They all are required to have psychopharmacology and psychotherapy. But I would argue that when you look at a lot of the programs, they deliver all that content academically, but it doesn't necessarily translate into the practical setting. The reason why that is I can go into practice tomorrow and see a patient, and I can spend 30 minutes with one patient with a moderate complexity code just prescribing a medication, and I could get twice the amount of money compared to spending 45 minutes with the same patient doing psychotherapy. So there are some systems problems associated with this. One of the things that's going to be unique about Duke is that our students are going to develop equal skills of psychotherapy and psychopharmacology. That's going to address some larger problems nationally, one being the polypharmacy problem. But two, another issue is that there's this compartmentalization of care that doesn't seem to work very well. If we have nurse practitioners who can do both psychotherapy and psychopharmacology together, it's the best case scenario.
Telehealth is not something new to Big Duke as far as the organization, but it is new to the nursing community at Duke School of Nursing. So what we've done is we've taken something that's really been employed in bits and pieces in psychiatry literally around the world, and we've brought it home to School of Nursing, and this is going to be very unique to this particular program where we embed those elements through the entire curriculum. What also is very unique about this program is there is an addiction crisis in the United States, and so we have an additional course that is required. It's an addictions course that is required of every nurse that comes through this program, but also on top of it, they have to take the Suboxone competencies as they take that curriculum. It's the Obama administration authorized that for all nurse practitioners a couple of years ago, and so that's part of the core curriculum in this particular Psych NP program, so that they have those competencies when they leave this particular program.
When you think about it right now, we're in the midst of somewhat of a mental health crisis. There's insufficient resources across the country, and those resources are particularly exquisitely vulnerable in certain areas, like in the rural communities. So we're clearly identifying a need that's been recognized at the state level, but the national level, in terms of building the infrastructure to have more mental health providers out there. But it's not just about the numbers, it's about the quality, and that kind of goes back to the content we've been talking about today with you, which is really focusing on a good balanced skill set, making sure these individuals address high risk, high volume, and problem prone issues that are common within this patient population.
So if you think about the United States, all the numbers say 1 out of 5 Americans at some point in their life will have a mental health illness. That's a lot of individuals. And we know about where those mental health providers are. They usually accumulate in the cities. So most of your mental health providers in North Carolina, they're in Raleigh, they're in Durham, they're in Winston-Salem, they're in Fayetteville. But North Carolina is mostly rural. So we have a lot of counties, around 12 to 19 of those counties, that either have no prescribers or only one prescriber. There's a significant need for nurse practitioners to be able to practice in those rural environments. And we know through the research that the providers that is most likely to go to those rural communities are those nurse practitioners.
I think a good candidate for this program is somebody who has a genuine interest with the population. They also have some experience. It's not just enough to have psychiatric nursing experience. We'd like them to have some medical surgical experience. Another big variable that's kind of important to bring up is these individuals have to be mentally well themselves. It's absolutely critical when we think about delivering care. This is a stressful job, so you have to kind of make sure that you are well before you ever consider caring for other people.
Yeah, there's an old adage, physician heal thyself. So we really want these candidates to be emotionally intelligent and resilient, because this is a group of individuals who are very vulnerable, and we want these providers to really understand that you have to have a strong constitution and disposition to take care of these individuals.
I would recommend any individual who's interested in applying to take some time to do their own research. You can go online to the American Psychiatric Nurses Association and look at the scope and standards for psychiatric mental health nursing practice. That's the principal tool we use to kind of determine what the role function is. I also encourage these individuals to take some time to actually spend time talking with established psychiatric mental health nurse practitioners who have been in practice for a while. The goal there would be to give them to some degree informed consent about what the role is and what the role isn't.